as Tracy said, my name is Michelle Gerrard. I use she, her pronouns. I'm a senior research manager at Wilder Research and the co-director of Minnesota Homeless Study and the Reservation Homeless Study. So my area of focus is housing and homelessness, as well as the intersections. So child welfare, chemical dependency, substance use, mental health, all the things that come into play with regard to people's experience with housing. So really happy to be with this great panel today. I'm super excited. So first we'll do a little bit of intros and then we'll get into it. But before we start, I just wanted to know how many of you out there have worked with a family experiencing housing instability? Okay. How many of you out there feel like you're an expert on how to get housing? Okay, good. So we have about, 45, 50 minutes. But I'll turn it over to our panel, and I wanted to say that this is not just a housing panel, that we also have a public health expert on our team here today as well. So we're going to kind of, public health, as my colleagues at Wilder say, public health encompasses all things. And so we're really honored to have a public health expert as well. So we'll start at the very end of our table, if that's okay. Do you want to go this way? Oh, okay. Should we go this way? I'm very flexible. All right, we'll start with Tamara.
All right. Hello. My name is Tamara Stark, and I'm with Tubman. We're a metro-based agency, community-based, range of violence prevention and support services. And I work as Senior Director for Housing and Youth Development. So it's a range of our housing portfolio of programs, economic justice, and community-based youth work and violence prevention. And we do have a public health model as well.
I am Jamilee Brown, and I work for Hennepin County's Adult Representation Services, or ARS, and we do civic public defense for areas such as housing, parent representation for CPS cases, and guardianship and health equity legal projects, also known as HELP as well.
Mary Pumphrey, and I work at CommonBond Communities, which is a provider of affordable housing in 4 states, including Minnesota. I supervise a team of direct service providers who work with residents who are at risk of losing their housing. So in all of our buildings, we provide some level of wraparound service. And yeah, I think that's it.
Good afternoon. My name is Amy Mimm. I work for Dakota County Public Health, specializing in our family home visiting program that works with pregnant and parenting families, where we have a public health nurse that does visits in the community and home-based, looking at an ecological, holistic approach and strength-based approach with families, and like trying to teach and empower families, but also help them connect to resources and housing instability and lack of affordable housing and poor conditional housing is prevalent in our program, as it is in all of yours. And so I think that is where our intersection is.
Excellent. Thanks for the intros. So can you talk about ways in which your work overlaps with the works of folks in this room in terms of child welfare, keeping children, families safe and supported? In what ways does your work overlap with that?
Happy to start. So ours overlaps in several ways. We do get referrals in for families that are working with child protection workers. So at times child protection workers are referring into some of our programs to support the family in overcoming if it's experiences with violence and that impact. And so we also I personally have had a lot of experience collaborating over the many years with child protection, child welfare, and raising the voice, making sure the people experiencing violence, the survivors, are centered in their experiences, and that we partner well together to overcome what are huge barriers for people impacted by violence, including the houselessness due to violence, which So our work in that space to do the supportive services is upholding survivor-centered rights, which often a lot of tenants, like landlords, aren't aware of those. So our teams in that space are doing a lot of upfront education and making sure they're agreeing on what needs to be upheld specific from their end to safely house survivors. And then we also do the long-term support services for that too. And then certainly with the range of our agency services, everyone has some touch point with child welfare.
At ARS, there is overlap between housing and parent representation for the CPS cases that I see. Very frequently when children are placed with CPS or in foster care, if they're on some type of substance or housing assistance, that gets removed once the children get removed out of placement. And then so there is some type of housing instability. And in order to replace them back in the care or reunification with the parents, they need to have some type of housing. And so navigating those systems and resources and making things available to create housing stability. In addition to that, there's kind of reoccurring clients that I see as well that may show up in eviction court or housing court that overlaps with parent representation cases as well.
I think in some ways the work that we do is sort of the fun part on the continuum of houselessness, in that we are the ones who get to say, here are the keys, you are now housed. And a lot of the work that we do is what comes next, how do you keep people housed? And I think that really comes down to helping people navigate these complex systems, but also acknowledging that some of those systems are internal. It can be difficult to understand what it means to live in affordable housing, what your reporting requirements are. So really just trying to support people as much as possible in accessing resources that are available to them so that they can stay housed once they're housed. Sure, so we kind of work, our core is housing stability, so eviction prevention is really our main goal. Well, I would say safety, then eviction prevention. But around that sort of central focus, we have education and advancement programs, both for youth and for adults, health and wellness programs, and then community building and engagement. We also work at a range of intensities, from permanent supportive housing units where there is fairly active case management, all the way to buildings where we don't have a service coordinator on site, but we work with property managers to provide them with training and resources to be able to provide kind of information and referral, as well as supports that might be needed when someone's housing is at risk.
And then because my lens is family home visiting, I can talk a little bit about other programming in the public health department, but for my lens being family home visiting, we do like to think of ourselves as primary prevention. And so we're trying to empower families and teach families and really sky's the limits with their abilities that they start with. However, risk is not static, and so sometimes we do have to work with child and family services, whether through the parent support outreach program or child protection. So that's how we interact. And I would say other community-based programs and county-based programs we also interact with, such as like the other organizations within the county, like community living services, which can be like waivered services, community corrections in terms of women coming out of incarceration and getting connected with a public health nurse to parent her kids and get connected to resources to feel successful. And then also crisis response. And then we also work a lot with our housing unit in terms of trying to connect families to like temporary housing in an emergency situation or ongoing housing issues. Oh, then I'll just add like back to what I said I was going to talk about. Again, my lens is family home visiting. However, in the public health department, there may be scenarios in communities that the housing is substandard. And so we do have to work with community, like either city councils, because there might be like an apartment unit or different communities that has substandard housing, and it almost becomes an emergency situation. So we have to set up a resource center to kind of help families advocate with the landlord to make the repairs, or maybe the place has to, like, people need to leave and find other housing, but not wanting to make that an emergency, to help, like, have months to help families plan and get connected to the services so it not be an emergency. And that would operate under like an emergency preparedness model in collaboration with social services and housing.
Like to pick up on that point too. For our scattered site supportive services that are in apartments, usually for people that we're serving for 2 years in partnership with Housing and Urban Development, it's called Rapid Rehousing. And it's the survivor-centered access for housing. Those have to go through the county to then be referred back to us, like different counties. And for HUD, when we're doing that search, we need to have inspections done before we would even be able to use those funds for good reason to make sure they are meeting the basic standards for health and safety. So that if a property that we were found a listing for, then that is not one we would be able to have anyone stay in, because if it didn't pass an inspection first. So just know that for HUD-funded programs.
Excellent. There's so much nuance in the world of housing. One of the things that I was thinking we could cover at least briefly is, since the theme of this conference is collaboration with landlords, because it sounds like that's a common theme among all of your work a little bit, is either the private or the group landlords, and thinking about the folks in this room and trying to get housing where they can't maybe always get into Tubman, CommonBond, maybe some have to work with private landlords or whatever. Any advice you have about how to collaborate with landlords?
Yeah, we're doing that. We work with 80 different property managers in the space of our metro range for scattered site, and most are unfamiliar with like survivor rights and how to protect those rights. So we communicate that too with some of our national partners, like National Network to End Domestic Violence, just so that there can be more broad-based access for property managers to have that up front, because it's a lot of time then for us, but to go over too. But I think that collaboration is so key. So, and we track also experience, like we're making sure there's good tenant education for the people we're supporting, and that the property manager knows that, what we will provide. So we're really clear on that, and what we, hope that they can partner with the people with too, and that so to make it a win-win. And we do track kind of experience, like how things are going, because property managers can really impact a lot for someone's housing situation. So it's really important to have a strong communication, strong relationship with them, and that they're able to share concerns direct with the people we're serving too, and that we can coordinate care in some way, because obviously our big role is ultimately making the space and the conditions where people can sustain their housing safely, as it's so foundational and key to every area of life.
Did you want to add anything, Amy? I see you lifted the mic.
No, I guess I'm just like, I want to hear about how to work with landlords. I know, like, my experience in Dakota County, it can be like when there's housing issues and code issues and people are living in substandard housing, that can be a little tricky, because not all city have city ordinances, or sometimes cities want to default towards county and county want to default towards city. And then if it's rural, or if it's private property like an apartment, or if it's a manufactured home community, there's not always a clear jurisdiction and an enforcement body. And so it's hard to know who to talk to and who can enforce the issues. And I kind of call a peer out. She's working with a family that they live in a manufactured home community, and there's a water issue. So 4 homes don't have water connected, and they're going on week 4. But because it's a private property and it's a private well, the jurisdiction of who can enforce fixing that is not clear. And the nurse has worked with the city, the county, the state, and also the property owner, and it's just not, again, we're going on 4 weeks with no water to 4 houses. And so I don't always know the answer to that either.
Time to involve the legal system, perhaps. Jamilee, do you have anything to add from your work in eviction prevention?
Not necessarily. I mean, tenants do have like certain rights and different things they can do, such as withholding their rent and rent escrow, things like that. That kind of puts the pressure on the landlord. That forces them for changes to be made. As we know, a lot of the systems that we work in is ultimately pressured by money. Money is a big factor. So when you're withholding money and different things, there are different resources that the tenants can use, such as Volunteer Lawyers Network, our Mid-Minnesota Legal Aid, where they can reach out to these free organizations to see what legal support that they can receive when filing things such as a rent escrow.
I would just add too, I think you're hearing, I know we're working, all of us have all these experiences with these systems. I know you all do as well. And some of it, let's not lose hope too, because it is very complicated. And a lot of us have spent a lot of time in system change initiatives, some with great result. And then I also just want to make a pitch for, sometimes it's about building the world and culture we want to see and kind of showing the way and hoping the systems will follow, because they'll see what has been built anew that is really strong. That requires very flexible funding, which is very hard to come by for nonprofits to do that. But those are opportunities that I would just make a pitch for all of us to be ambassadors around, so that we get some more flexible funding to really center the experiences and needs and strengths of all the people we serve.
Hear, hear. Flexible funding, key to serving some of our folks. I know in one of the worlds that I walk in working with HUD, the federal government, you literally have to be outside or in your car before you can get some emergency shelter services. That seems like flexibility would be key at that point as well. So, so because this is a heavy topic, I want to just talk a little bit for a minute about successes for a second. Can you all talk about some of the things that you've seen that have worked really well in this arena in terms of either collaboration with other types of fields, or in terms of some of the better practices that you've seen in housing folks that experience multiple challenges?
I can give a recent example. There's been some newer apartments built in Dakota County, and that have allowed for programming in them. And so we do have nurses that go on site and do programming around pregnant and parenting and supporting families, and getting to meet the families and really empowering the families to make it their programming, not like the nurses' programming. And some really nice connections that have been made within the residents, so that way like it's their group and it's their connections to kind of keep going, but also still offering that that family support and programming within the housing.
We're fortunate in our space. We've had co-created programs as far as the people directly impacted, including youth, have been able to share input over the years of what's meaningful for them and relevant. And then we go forward, right? So that's been a strength, and we continue to get that information through a variety of methods as people so choose to participate in giving their input and leadership and insights. And we do compensate people as well for their expertise, their lived experience expertise in that way. And it's I think it's just through and through see that as a great opportunity. And also with our public health partnership. So while it's housing impact with youth, they have been so keyed in with knowing the needs and strengths and and wanting to resource opportunities for people to have stability, to thrive. And that is just a model I share with other funders, because that's kind of rare to have an entity that's also an arm of local government really be so keyed in on community needs and strengths, and wanting to be backing things up well with resources, and also even to the extent of evaluation, being able to source evaluation, and so that it really is centering the experiences and building out what works well as a way to show and overcome barriers too.
Mary, how do people get connected to supportive housing services?
Supportive housing in general, I think people who are experiencing houselessness or I think at risk of becoming homeless in Minnesota go through the coordinated entry process. And so a number of CommonBond buildings are specifically set aside to work with supportive housing clients, and then many buildings have units within that larger population that are coming through coordinated entry and are designated supportive housing units as well. But there are other paths which really are very similar to going out and finding an apartment. You might use a tool like Housing Link is a great one that can help you identify affordable housing. You can filter by subsidy type, so you could find something potentially that is income-based if your client needs that. And then it's a matter of doing the really tedious work, unfortunately, of contacting those individual buildings sometimes and seeing if their wait list is open and filling out an application. I wish that was more streamlined, and that you could fill out one application and get on every wait list. And unfortunately, I'm going to blame HUD. That's just not possible.
We love blaming HUD. It's great. Yeah.
So it's still really complicated, even if you're trying to work within one agency, unfortunately.
And Housing Link, I'll just do another plug for them because they do have some special funding to help with folks that have a criminal background, to provide double deposits if deposits are needed, as well as guaranteeing last month's rent if something happens for a family. So it's sort of like an extra measure of protection to landlords for people who have a criminal background and they've only had to use it one time, the extra funds. So just goes to show you we can house these folks and they can be stable. So, okay, so a little bit about challenges. We know there are a lot of challenges in housing related systems. We know there's a lot of challenges in child welfare systems. Can you talk a little bit about the major challenges that you experience when working across systems?
Just to kind of piggyback of what you're saying, one of the main challenges can be a criminal background or credit score. That program that you're talking about with Housing Link Beyond Backgrounds, I've worked with several clients with that, and that has been successful, of them working with Beyond Backgrounds, and it's just the $300 deposit that they have to pay for that, and then it does open the door for more housing opportunities for a lot of the clients that I work with. In addition to that, I'm in housing court several days during the week. On average right now, there's about 210 evictions a week, which divvies out to about 10,000 a year, and that's just in Hennepin County. And really, in reality, the issue is that affordable housing is no longer affordable. Based off of the current numbers, here in Minnesota, the average price of rent is about $1,600 a month, and the people that we service at ARS live within 150% of the poverty line. And a lot of those families can't afford $1,600 of rent. So really, in reality, the issue comes down to the pricing of rent that's being charged.
And what do we do about that? All right, we'll work on that in a second. Okay, keep going, Tamara.
Yeah, I would echo all of that, but we see like emergency access to housing. So, there's shelter systems in place, right, for people impacted by violence that don't have to go through the county system for immediate access. But when you get into the longer term options, that is a much slower process. So there's so many people unfortunately going from shelter to shelter because people somehow think they're magically getting into housing, but it's not happening, or they're on the streets exposed to more violence because of these shortages and financial gaps that we know are huge disproportionate impacts on Black, Indigenous people of color through and through for decades. So I think that emergency access housing first option, if I could wave a wand, that would be great. And then some more about what that is. Yeah, so that's just that there's safe and housing options for individual or family size to accommodate their needs. Single occupancy or rental unit that they can access immediately upon needing stable housing. And that would be great. It would go a long way, because it's one thing to move by choice with resources. It's another to have to move under duress and trauma with not enough of anything other than love for each other, and that's great. We build on that a lot, but it's very, very tricky to not have a system that really. Sometimes we are in spaces where we feel like, is there momentum to really solve this? Because these challenges are not new, and we're seeing the impact of a lot of failures of best laid plans for systems, right? Or some would say working as designed. But so I think that emergency access to housing opportunities, more rent-to-own opportunities, and then also remembering the economic impact. One thing for people impacted by violence is 99% have been financially exploited as well. So huge economic justice issues, and those start with children too. It's youth impacted by that as well.
I just wanted to add that I liked how you phrased that affordable housing is no longer affordable. And I think about some of our units are income-based. So that's just about the most affordable housing that exists in America. But an issue that happens is that 70%, minus that 30% of your gross income that you're paying towards affordable housing, 70% of not very much is still not very much, and as cost for other things rise, that 30% that you're setting aside for your housing, while it doesn't make you rent burdened, right? Like you might be if you were in the private market, but you might still struggle to be paying rent. And we saw that certainly during the earlier part of the pandemic. And I think that there can be a perception that if you're in affordable housing, you should be able to budget, then you should be okay. And I think that there are many families who, even with that benefit, are still really struggling to make ends meet and need like rental support. Emergency rental support, I think, is something that was so great to have for a period of time, and really, I think, could be just incredibly impactful if we could continue it.
For our site-based youth housing, that's a 2-year option plus aftercare, we purposely designed that based on the input from youth years back, with it's rent-free. And we did that for a reason so that, one, earning potential for youth it can be trickier. Yet when they are earning, it gives them a little launching pad of some money to start off from, because it is people who have, huge gaps in generational wealth accumulation that we're serving. And so to even begin to overcome that, and in our programs where we're not able to do that, such a portion, we're looking at community resources to supplement their income to really get over those big humps, and building in our budget some financial assistance as well. But it's just, as you've heard, these rising costs everywhere, just hearing about rent, but also everything else, transportation and childcare. It's just a package, a very very tricky financial picture for people. And so we really have to attend to that piece as well.
I can do it, Stacy. For Amy, how do people access a home visitor? How does a worker get connected with a home visiting program?
Like it can be a referral through their worker, whether it be like through child protection. We really try to do outreach with community clinics, child protection, and like WIC is that's our major source, because we really want to see pregnant and parenting families. And so WIC, and I'm just trying to drawing a blank, but really anybody can call. Every county has a family home visiting program, and every family would have a website that would have either a direct phone number for a referral or a website to kind of do an online referral. It just depends on the site. And I know family home visiting has really added, because of federal grants and state grants, the family home visiting program around the state of Minnesota has really grown. And sometimes you hear about evidence-based models, and every county has an evidence-based model. But I would say that sometimes community service people can get confused, oh, my family won't qualify for that model, or they won't qualify for family home visiting. And I would just say, before you kind of screen out, call your local county or your local home visiting agency, and they'll find the programming instead of, so don't screen out a family and say they won't qualify for that. Just call. I know Dakota County will find something. And we also want to say that it is voluntary. And so, like I said, we don't work a lot with child protection because we don't want to, in terms of we're not, we want to be strength-based and empower families, and, and so that way families can aspire to be the parents that they're meant to be. And so we're not working with them. And then I will say, if child protection refers to us, it has to be voluntary. If it's a court-ordered plan, we would actually go back and say it can't be court-ordered. It has to be family volunteered, because we really want to give family agency, and they're going to better engage in the program if they see the benefit and the motivation and see the partnership and how we're going to build on their strengths, instead of having it be a case plan or service plan.
Work, right?
Yeah. I would say over the years, though, too, I've seen a big improvement in child protection responses. So when that is a service in there, I feel it's more automatic to be trying to look at what other service supports can be in there to keep the family together if that's the interest too. So that's been something I've definitely seen improvement on too.
Collaborating with you. Child protection collaborating with your, okay. What advice would you give folks in this audience about some of the overlaps in the folks that you serve, how to work best with them, how to best coordinate services, how to prioritize given the multiple challenges that families face?
I would say definitely partner and really take a strength-based approach. Sometimes when you ask a family, it's like ordering from a restaurant without a menu. They don't know what to ask, and they can't say their strengths. And so really kind of work alongside a family and have conversations and get to learn a family's strengths and build on that, and really kind of give the families the tools to empower themselves to reach their full potential, and always acknowledge that, and acknowledge it's the family doing the hard work based on their own hopes and aspirations for themselves and well as for their children. So really taking that strength-based empowering approach and that collaborative approach. And then when you do work with other service providers, I think it's very important that the family is like agreeable to that, and family is participating in that collaboration and the communication, because I think it can cause a lack of trust if service providers are only talking about like the family kind of behind the back, you know, and then the family is like, well, I wish I would have been included in that discussion. And so sometimes it is easier, like, hey, did you refer to here or that, kind of like a quick, but if it's like planning and engaging and kind of what is the plan for this family, I think we should always engage with the family and give them as much agency as possible and really build on the strengths, because many of the families have been through a lot. And I would say with that, they have a lot of skills, and more so that we give credit for. And so we really want to take that empowering approach.
Definitely echo that. Thank you. And huge yay. I think too, none of us can serve right alone. So collaboration is like key. And so how we open that space of finding out who are, hearing from people we're serving, who are they already working with, how's it gone, what did you like about, what didn't you like, what would you like more of, and then working. People want to see us go the extra mile too, based on what they're the experts in their life. So the more we build on that, I think the better off we are too.
Any advice from the rest of our panel? Need deep, wonderful fixes?
I would say the same thing. I think that a lot of times I see our clients where they've already ended up in eviction court, and it's kind of like the question of how you ended up here when there's been like several months of unpaid rent or whatever the case scenario is, and really doing that outreach and collaborating, even if you don't necessarily work in housing for your job, reaching out to, organizations like Tubman or like ARS or like all of us that are up here, and really seeing, because we do have resources available. Even if you don't, we're able to provide you or direct you somewhere that can. Another tidbit is a lot of our clients, sometimes they don't show up to court because they're scared that they're going to lose their housing. And that has the adverse effect. If they don't show up, they automatically default, and that goes in the favor of the landlord. And a lot of people don't know that. Our clients don't know that. The workers that are working with them don't know that. So really providing them with that information. And if they do show up to court, there is resources available to help them and assist them along the way.
See that on the back end too, just when there's legal involvement, of time away from work and then a job loss. There's just so many ripple effects, right? That we're trying, and then, like you said, not showing up. A lot of people have really fears of court in general because their prior experiences have been negative or family member, trauma related. So like that social emotional support and navigation in those spaces is so important too. And thank you because there's people out to assist with that.
I'm on mute, but here we go. I was a Girl Scout leader, so I can talk really loud even without a mic. So one of the things we really struggle with in this field, and is really apparent in the housing world, is racism. And the huge overrepresentation of African American and Native folks who don't have housing and have not had access to the generational wealth caused by owning your own home. Do you have any thoughts on ways in better working with folks who are African American or Native in accessing housing, or better elevating the issue to people who house those folks?
Well, I think not hiding from it. So being like, I hear a lot from very well-meaning people, right, in our field about, well, they have mental health issues, so that's clearly why they're homeless. They have drug addiction, so that's clearly why they're homeless. And it's like, everyone's housing ready, and we can do customized support around that, and that lays a key foundation. And sometimes when I hear that, I feel like it's like blaming the people instead of looking at federal policy. caused this. It's been designed at the core, and it's impacting exactly the people we see today as how it was set up. And the federal government acknowledges that, and there's great tutorials on it. So if you haven't been through those, I would definitely encourage you review that history so that we are naming it. We are sharing it also with people we're serving, because they feel often very like it is all their fault, and sometimes it's very freeing and empowering to know that history and be like, wow, this isn't just me. This is some big, larger, unseen forces that I'm feeling so deeply. And then they're very fired up to be a part of, changing things too, and doing that civic engagement and, to make a difference. My family was impacted by redlining. I was born in a sundown town. I mean, this is recent history that's still showing up today, leading to these disproportionate impacts. So I'm huge advocate for making this known, sharing it with friends and family, helping people see their part and how they can make a difference to change this and say, we are done with this, we're not going to stand for it.
Anybody else want to comment on that? Thank you.
I would just say really asking our clients questions, and we keep having this recurring theme that they're an expert at their own lives, because they are, and meeting them where they're at, figuring out the core issues and trying your best to provide resources, whether that be a call to 211, whether that be realizing that that person has no employment, providing them resources for employment, doing what you can and fully asking and not assuming, I think can go a long way.
Boy, that's a theme of this conference too, isn't it? Asking. Yeah, one of the things that strikes me in working in the housing world is that to apply for a mortgage, nobody does a criminal background check, but to get an apartment, they do. There's a disproportionality right there, isn't there? So thinking about how that impacts us today, thinking about background checks, and they didn't do those when I started renting out of college. They didn't do a full credit check, full background check, full thing. I once talked to a woman in a shelter who was in shelter. She was wearing a suit. She was going out on an interview, and she said, yeah, I used to be a bank teller. And I worked at a bank for 20 years, but then my bank decided to do retroactive background checks. And I had a criminal offense when I was 18, and I got laid off. And she was homeless because she was living paycheck to paycheck, as a lot of us do. So very professional woman, homeless in a shelter. So I have hundreds of stories like that. And so one of the things we're here today is like some of the folks that are impacted in the child welfare system would not be there if they had stable housing. And so really like thinking about that hierarchy of needs and how you can't deal with any issues until your housing is stable. And I know I'm preaching to the choir here, but any examples that you all have from our panel of some of the system solutions that you have seen? So we've been talking a little bit about, it's kind of a painful subject. Like there's a problem, right? Like, but I know right now there's legislations like right now being talked about in our state to provide a bunch of housing vouchers. And we do know that housing vouchers are very helpful to our families. Any other system solutions that you all can identify?
Oddly enough, because I work with parent representation cases for CPS and eviction cases, the ones that get more funding are the parent representation cases because they're now opened with CPS. And so the judges in those cases are able to grant things such as application fees, deposits, first month rent, where when working in housing court, they're not able to do that. So in some cases, it is beneficial that CPS cases have been open because it does create some level of stability. Even though it's not like that for a majority, there is some justice being done in some of them.
I would add to like being engaged and aware of the policy change agendas driven by people directly impacted. So whether it's African American Leadership Forum, you know, some of the focus why they're asking for certain changes is to, you know, offset the burdens in these specific areas. So there's a lot of statewide coalition work, and they have policy agendas to improve these conditions for people that are historically marginalized, because so much of this also is economic. I think you probably heard from us as well. Like, and like you said, with renting alone is much more vulnerable for people, right? Because you can be evicted so quickly. You know, in higher wealth areas, there's people sometimes facing, you know, a job loss, and yet they own their home. So it's going to be a while before foreclosure. There's just a much longer runway.
I wanted to add that in federally subsidized housing, Violence Against Women Act protections provide like a lot of protection for victim survivors that we don't see in the private market. And so even though in Minnesota we have some pretty great laws, like you can break your lease in Minnesota without penalty if you are a victim survivor, we don't have things like a coordinated transfer between buildings, which is something that you can do if you are living in a federally subsidized building. And I think kind of expanding that protection would be really helpful. And I think also trying to coordinate between agencies who might have different open units for people who are trying to transfer under VAWA. It can be difficult even within an organization, and really hard to find out like what other agency has a Section 8 unit available for a transfer. So more coordination there.
Violence Free Minnesota, our coalition on that too. They have a lot of policy advocacy specific for survivor-centered needs in the housing space. One thing, I was actually just talking about this with our legal team, that's a great remedy. And then the dollar backing though is still needed for people in many situations. So sometimes there's still a concern of breaking the lease because like what's going to happen next. So and then like you said, the awareness of it too, even that it's an option.
So if these folks are working with a family that would qualify under VAWA, how does the family, like, how do you get connected? Like, how do you get to access those rights under Violence Against Women Act?
Yeah, it's like technically you must uphold it. So it's sort of like it's a law that you know someone can't like not follow technically, but the problem is a lot of people, like you were saying, you know, don't know about it, and certainly many survivors don't know that's an option. So unless they're kind of connected in this space, so basically a lot of community education is still needed about some of these things, and you've heard how just an iceberg of how complex it is. and so I think just getting people connected is a big deal, big part of our outreach to all of us here, I think, and all of you. So thank you.
And I think, you know, I'm sure we're using words and terms up here that not everyone is familiar with, like the word coordinated entry. How many people are familiar with coordinated entry? Oh, okay. That's good. That makes me feel better. Sometimes when you live in your own little world or your own little field, you don't know the words that the other field uses. And that's another thing to ask, right? Like one of the things we talked about was just ask. But one of the things that I always tell folks is like, we do have a huge increase in our state of people that are outside, unsheltered folks. And that includes some of the folks you all are working with. And I get the question all the time, like, why don't they access shelter? And the thing I've heard a lot is pets, partners, and possessions. So if you have a pet, or you have a partner and you want to stay together, or you know you have a family and you want, you know, there's a lot of shelters you can only have the men go in one wing, the women go in another wing. There might not be a family area as well. So really trying to figure out how to better serve people in those unsheltered situations who want a choice in how they live even in shelter. So it's something to think about. Every single system is pretty darn complex and has tons of barriers. We're gonna wrap up with some questions, and Stacy's gonna go around. Great, thank you.
Okay, good afternoon. So all of you have spoken to how complex the housing system is. We also know that in child welfare, housing is often seen as a reward, maybe not the platform for families to come together and be whole and address whatever issues are facing them. And then we also know the timeline to housing, when it's going really well, it might be 3 months from the time you start your process to you're actually moving in. And when we think about the timeline of child welfare, they don't align, right? Like families need to be stable much quicker. And we also have a room full of social workers. And I'm wondering if any of you could share an example of when a social worker stood by a family and really kind of played an advocate role or helped kind of explain maybe a bit about what's going on in the housing system, or really was able to help that family step into the housing world and be a part of that collaboration. And so just thinking about the background checks, about having a rental history, or kind of how can a social worker stand by a parent and help enter into this very complex world.
Many of those examples, I think that's one of the big changes I've seen in the positive, is that people in this space are standing by, trying to walk along, get people connected to, kind of that active listening to people they're serving, and kind of repeating back, is this what, helping advance like informed choice about options out there, and then connecting them to a service provider, and then coordinating care. And yeah, spot on about the 3 months. That's great recognition, because our prep research with people referred in for housing options averages 3 to 6 months is kind of how that goes. So yeah, I think that being a connector and walking alongside and everyone clarifying their role and their part of what they're doing along the way, and making that very transparent and centered with the people and families being served.
One of the things I was just going to add is in some of the work that we've done, social workers have helped in the appeal stage. So if a person gets turned down for housing, their application is turned down, right? They went through the background check or whatever and something pinged. You can appeal it. And I think social workers have definitely helped families with that appeal process. And particularly with our nonprofit providers like CommonBond, they are much more amenable to that appeal process. It's a part of the housing process for those who get turned down.
I think we have time for one more question. Elena.
Hi. So I know you all talked a lot about like what to do with families while they're in crisis and things. I'm curious about, because we know that the outcomes for those who are aging out of foster care for homelessness are abysmal. Foster Advocates has done some research in Hennepin County. 79% of those experienced homelessness by age 24, and we know that that's positive because we were reaching it was those who we could reach. How have you all seen child welfare agencies working with housing organizations to make sure we're preventing fosters from aging out into homelessness?
That's, I think, a big part of why in a few areas, but this definitely we get referrals in from child protection, to make sure that people aren't, left out on the streets or without support, definitely, so that they're getting that wraparound services and access to all the options to prevent those that falling off that cliff. We were just talking about too some of the new supports that are available. Again, I think a lack of awareness about what's all that's out there and changing for people who have been foster involved. For example, like access to free college and that, you know, so just being that service connector in relevant and meaningful programs for the youth, for sure. So our years back for the youth impacted by violence, we did a big intersectional collaboration with law enforcement, other nonprofits, youth directly impacted, to hear from them about what kind of meaningful services and support leading to one of the first, youth and young adult housing programs for youth who faced houselessness, who've been impacted by violence too. So I think, and building off those, centered voices of the youth. Does that answer a bit of your question?
And I think also I would just add to that, sort of that using extended foster care dollars to be able to help provide housing is another option. We know from our homelessness data that the most common age of first homelessness is 18. And so the mode for you researchers in the room. Whatever we can do as workers, as people in the field, to start having those conversations with young people about how to maintain stable housing, how to get housing. And for our youth who experience foster care, they may not have the safety net of someone to go back to if they lose their housing. So really some of those supportive housing services as well, where it's providing that sort of parachute if things go wrong in your housing situation.
Thank you. Join me in thanking our panel. Y'all can just stay put. Just stay put. Okay, I'm having them just stay put. Really quick, we're going to wrap up. I know it's been a full day, and really appreciate, I'm looking around, really, look at how full the room is, right? This is a topic that really resonates with people, and we're just so happy that you are all able to be here and to be able to network with each other and learn from each other and to be able to stay for the entire time. So again, I want to thank all of our panelists and our speaker. Marina had to just leave, our keynote speaker. She also stayed the entire time and is feeling very energized by the work in the room and the conversations. There's a lot of 360s on the table. Take 2, take 3, take them to your friends, give them to your grandma, whatever you want. Really good stuff in there. A lot of the people that you've heard from have authored articles in there. I've seen a lot of people taking notes throughout the day, and I also took a few notes and just want to kind of leave you with a couple things to think about as you leave. We heard a lot about the importance of communication, and in that communication, the essential element of asking questions, asking for help, leaning in with curiosity, to be able to better serve the people that we're working with. With that, of course, comes humility in our intercultural work, humility in the understanding and respect of the expertise of the kids and families that we're working with, and that they need to be centered and having their own agency in this work supported and valued and centered. Something that was said at the very beginning of the morning, and we really never circle back to it, but I really want people to think about this, is somebody said at the beginning, co-location matters. The research study out of New York talked about co-location matters. We're at a time in practice where we're not coming into the office in the same way that we used to. And there's a beauty in the ability for us to connect virtually and to be able to respond quickly, perhaps meet more quickly than we otherwise would have if we all had to get in our car and drive somewhere and meet as a group. So there's a balance, I guess is what I'm trying to say. Let's use technology, let's use our virtual opportunities, but don't forget the value of picking up the phone. I say that to people all the time. Well, did you call them? Well, I emailed. But did you call them? Call them, right? And if you have the ability to get together, that builds relationship. Many of us are social workers. Come on, we know this is our bread and butter here, people. Co-location and building relationship matters. Being in person matters. A few of the strategies that were talked about this morning, and I'm just going to name a couple. Interdependence. If your philosophy is that the way that we work with kids and families and help to preserve families where children are safe, if that's an interdependent responsibility, it doesn't lie with any one particular discipline, then we are going to be much better positioned to help families have success. Anybody that thinks that they're in it alone or need to lead it alone or be top dog, it's not going to go well. Interdependency. We also heard a lot about having the relationship and sometimes having a leader. Having a leader that leverages resource, having a leader that might help us develop policy, having a leader that encourages us, supports us, and says, yeah, that's a really different idea. That's a different way of getting together. Go do it. I totally support you. Cultivate those leaders. Be those leaders. Those are things that I'm hoping that we can all leave and think about.